Hello, everyone. I'm Zhaojing Chen. I'm an associate professor from the Department of Kinesiology at California State University, San Bernardino. Today, I'm going to talk about exercise and bone health, and it is my pleasure to present this topic at the IOHSK conference. So I'll talk about some current evidence from research and physical activity guidelines on exercise and bone health. Followed by one longitudinal study or intervention study from my lab, and then ended up with future directions. A little bit background about the bone health. As you can see here, our bone density accumulated at a young age, especially from 10 to 30 years old. This is a rapid bone building phase, and we will reach our peak bone mass around 30 years old. After that, from 30 to 50 years old, the bone density is maintained and gradually decrease. And then after 50 years old, it has a rapid decrease, mainly due to aging, especially in women due to menopause. So generally, in the US, about 20% of women and 5% of men over 50 years old experience osteoporosis. So what is osteoporosis? So the definition is that when the bone density decreases and bone mass decreases, and then the quality of the structure of the bone change. So this leads to increased risk of fractures. As you can see here, this is a healthy bone, and this is an osteoporotic bone, which is more porous and thinner. It's easier to break when an individual falls. So it has a higher risk of fractures. So how do we know our bone density? So clinically, we use this big table here known as DEXA, dual energy X-ray absorptiometry, to measure our bone density. And usually we measure it at our lumbar spine, this one here, and dual femurs, so left and right hips. And the bone density is measured and compared to young adult population. And so if the BMD is more than, the bone mineral density is more than 2.5 standard deviations below the young adult population, then it is considered as osteoporosis, which falls in the red area in the figure of the report. In research, we use bone turnover markers also to quantify the bone metabolism. Because the bone metabolism is a dynamic process, and it's a coupled process with bone formation and bone resorptions. So bone formations are the bone building phase by the osteoblast, which is this one here, right? It will release some chemicals, some molecules or enzymes into the blood, such as osteocalcin, or bone ALP, and P1NP, P1CP, and can be detected in the blood. And during bone resorptions or the breakdown of the bones, osteoclast will release some bone resorption markers such as TRI5B, CTX, and NTX, PYD, DPD, and they can be found either in blood samples or urine samples, right? So these are bone resorption markers. These are bone formation markers. Also, there is a regulator of bone turnover metabolism, such as sclerostin. So these markers can tell us the dynamic process of bone metabolism. So how do we maintain bone health? In general speaking, both nutrition and physical activity are important for healthy bone. For example, for calcium, want to take at least 1,200, a minimum of 1,200 milligrams per day for women over 50 years old and men over 70 years old. And also vitamin D is important to absorb calcium, right, to strengthen the bone. In terms of physical activity, there are non-weight-bearing physical activities such as swimming, cycling, as well as weight-bearing physical activities such as running, which are ground impact activity, and weightlifting, so basically lift against our gravity. So research has shown that non-weight-bearing physical activity is not a goal for our skeleton. On the other hand, weight-bearing physical activity, they are the best, especially the weightlifting. They are the best to increase our bone density and strengthen our bone. So there are numerous research has been conducted on the effects of physical activity on bone health. Now, for example, this meta-analysis from Kelly and his colleagues, they research on the randomized control trials on resistance exercise and bone density in women, and they found that for lumbar span BMD, there is a small but significant effects from resistance exercise compared to control group. On the other hand, for total hip BMD, right, there is small but insufficient, right, insignificant change compared to the resistance training group and control group. And similarly, radius BMD, the arm, bone, they have a small and significant effect from resistance training group compared to the control group. So in summary, they found that resistance training had a positive effect on bone density. At lumbar span, no matter it's pre- and postmenopausal women, and at the femur and radius size, that is mainly for postmenopausal women. Okay, what about the men, right? So this study by Hamilton and his colleagues look at the effects of exercise on bone density in men, and this is a meta-analysis as well. So figure 3 is the change in femoral neck BMD. So basically, as you can see, most of the change falls in basically the positive part, right? The positive falls in either positive or zero part, right? So basically, there is a significant benefit of exercise observed at femoral neck BMD, but not the lumbar spine. So based on this research evidence, in 2004, American College of Sports Medicine published a physical activity guideline on bone health. So basically, for children and adolescents, for teenagers, right, in order to increase or accumulate a high bone density, so it's important to do some high impact physical activity as well as moderate intensity of resistance training, or some sports that involve running and jumping activities, such as like volleyball, basketball, soccer, and at least 3 days per week, right? If possible, twice per day. So it's the frequency, right, is more important than duration. What about adults? In order to preserve bone health in adults, again, resistance training or weight bearing activity are important, as well as some high impact exercise, high bone loading activities such as volleyball, basketball, that we jump, we run, right? And a combination of all type of activity between 30 to 60 minutes per day, 2 to 5 times a week. That's beneficial for the bone. Although, right, the physical activity guideline on bone health is clear, right? And basically, most of the exercise should be dynamic and frequency, and is more important than duration and also high intensity. Right? However, recently, basically in 2009, there is a new type of exercise modality. It's called biodensity, was developed. So here is a biodensity machine. The different part of this machine is this is not a dynamic movement, instead, this is an isometric or static movement. So basically, on this machine, clients or participants can perform 4 exercises, including chest press, leg press, core pull, as well as vertical lift. And when they perform the exercise, basically, they need to hold for 5 seconds each at their maximum voluntary contraction. So this is a self-induced neuromuscular and osteogenic loading stimulation, basically. So some research has shown that biointensity shows the effects of biointensity exercise in older adults. For example, Smith and al. They found that biointensity training helped to improve leg press, chest press, vertical lift after 12 weeks in older adults, and also the combination of whole body vibration and biodensity training improve the static and dynamic balance. Another study by Harding and his colleagues, they conducted an 8 weeks long intervention study, either biodensity training once a week or high intensity interval training 3 times a week, and in middle-aged to older men. And they found that both type of exercise increase lumbar spine BMD, although resistance training or high intensity resistance training group improved more BMD on multiple bone size other than lumbar spine. The study by Hunter and his colleagues, they conducted a 6-month-long intervention study on bone density in women, and they found that hip and spine BMD increased for osteoporotic older women. So these are some positive effects of biodensity exercise. The purpose of our study actually is to not only examine the musculoskeletal effects of biodensity exercise, but also want to compare its training effects in both younger and older women. Because bone density is not only important for elderly, I think it's also important for the younger generation. So want to see it to compare their training effects. So here is our participants' criteria. So we had a younger group between 18 to 30 years old who are healthy, as well as an older group between 50 to 85 years old who are either osteopenia or osteoporosis, and menopause for at least a year. So here are some exclusion criteria. Basically, they shouldn't be too active outside of our intervention, and also they shouldn't have joint replacement or some disabilities or fractures to prevent them doing exercise with us. So here is a protocol, right? A study protocol for our study. As you can see, a total of 16 weeks are involved in our study. So it takes, 12 to 14 weeks long. So at baseline with the 1 and 2, we will do informed consent, baseline assessment, familiarization on biodensity, some blood draw, and bone scan on the DEXA machine. And during visit 3 to visit 14 are the training sessions once a week, basically on the biodensity machine. Before that, we have 5 minutes warm up. Visit 9 is our middle point assessment for the musculoskeletal fitness, basically for the muscle fitness. And visit 15 and 16 is our post-assessment. All the measurements were repeated during post-assessment. We also measured our blood samples in these biomarkers, such as sclerostin, bone ALP, and TRIB5B, using the ELISA case. And they have pretty good precision. So here comes our results. Right? So in total, we had 16 young participants and 10 older participants completed the 12 weeks of intervention. And I mean, as expected, right, older group definitely is older than the younger group, but there are no differences in terms of height, weight, and percent body fat. So this figure shows the average force production on bile density over 12 weeks of training. So blue is a young group and red is older group. So as you can see, young group always have a higher force production compared to the older group. Right? That's expected. Right? Also, we can see that over the 12 weeks, actually for chest press and leg press, both young and older groups, they had a significant increase of their force production. The trend is, I mean, a significant increase. Although there's no change on core pull and vertical lift in both groups. So these slides show the effects of bile density on muscular fitness in terms of grip strength, jump power, knee extension, and knee flexion. This is young, this is the older group. So first of all, we saw that, of course, younger group had a higher strength compared to older group. And statistically, actually, we did not observe any significant change over the 12 weeks. In terms of BMD, right? So we look at the lumbar spine, femoral neck, total hip, and radius, right? So first of all, we can see that younger group always have a higher bone density compared to the older group before and after training. Right? And there is no significant difference between before training and after training. No training effects in terms of BMD, although we saw a medium effective time and lumbar spine. What about the bone turnover markers? For bone ALP, right? So we saw a kind of a trend of increase, but this is after training, but this is not statistically significant. For tri-5B, the younger group has a lower level, but the older group has a higher level. I mean, the older group is increased, but the younger group is decreased. This is a trend, just it's not statistically significant. But tri-5B is a bone resorption marker. Right? And sclerostin, right? We saw basically the younger group had a much lower sclerostin level compared to the older group, right? And there is a slight trend of decline for the younger group, right? As over the 12 weeks, right? But keep in mind, sclerostin prevent bone formation, right? Inhibit bone formation. So the lower sclerostin is good for bone formation, actually. So these are all unpublished data from our lab. So in summary, right, we saw the 12 weeks of bile density training once a week improve the force production of chest press and leg press in young and older women. Right? However, there were no significant changes in terms of bone density, BMD, or bone markers such as sclerostin, bone LP, and tri-5B in both groups. And there was also no change on grip strength, jump power, as well as knee extension, peak torque. So as expected, right, we saw the muscular fitness and the BMD at all sides are higher in the younger group, right? And sclerostin level, which is the inhibition of bone formation, is lower in the younger group or higher in the older group. We did observe some signs of bone formation, such as the increase, a trend of increase in bone ALP, the bone formation marker after training, and there is a medium effective time. There is also a slight trend of decline of sclerostin after training, right? Especially in the younger group. There's also a significant time by group interaction in trial 5B. However, we do have to recognize some limitations of our study, such as the sample size. We only had 16 young women and 10 older women in our studies. And so it's relatively a small sample size. And then duration, we had 12 weeks of intervention or training, right? But bone adaptation takes long time. So it may take 6 weeks, 6 months, 8 months, and even a year to see the changes. And so 12 weeks is not enough. And lastly, we only did one biodensity exercise once per week, right? So it's interesting to see how the frequency, if we increase the frequency of the repetitions, and how does the response change in the future. So in conclusion, right, exercise is a key lifestyle intervention for bone health, no matter for a younger age as well as older age. Right? It's important for everyone. Although the physical activity guideline was published in 2004, but still nowadays we need to have a better exercise prescription in terms of the optimal exercise for bone health, and such as modality, intensity, duration, and volume, especially for some novel type of exercise. For people who don't want to lift weight or who are afraid of doing high intensity activity, right, is necessary to look at some other type of exercise. And long-term intervention studies, especially in human participants, is needed, as well as randomized control trials. They will provide more information on exercise prescription. So that's all about my presentation, right? So thank you for your time and attention. So here is my email address. If you have any questions, feel free to email me. And thank you.